Hello, Fernanda.
Hi.
Thank you for coming in today. I'm slightly concerned starting your appointment this morning. It looks like you've been having some difficulty with your facial sensation. Is that correct?
Yes.
Okay. So from what I was reading in your notes, it looks like you feel like you've been having some headaches or migraines lately, and that's kind of out of the norm for you. And you went to see your primary care physician, and they referred you to me. So I'm a neurologist, and essentially what that means is my job is to study the functions of the brain. So you have several cranial nerves, and these cranial nerves are what allow you to perceive sensation, taste, smell, so all of your senses, essentially. Now, it looks like the one that you're having difficulty with specifically is your sense of touch. From what I understand, you feel like you've been experiencing a little bit of maybe mild loss of sensation or tingling sensation. Is that correct? Okay, all right. So I'm just going to go ahead and get a pair of gloves on and we can get started. I have several things that I'll be testing today, and hopefully we can kind of figure out what could be going on. If nothing else, we can isolate an area of the sensation loss. And that will give me a better idea of how to move forward. Noting facial symmetry, looking for any signs of abnormal symmetry or atrophy of the face, anything that could indicate that there's something wrong with the musculature or that you are kind of losing muscle mass. I'm also looking for symptoms of a stroke or any facial drooping. So I'm just going to be touching your face in certain areas. Is that okay?
Yes.
Okay. All right, so I'm just going to have a look here. I'm going to start by just kind of having an overall look at your face as a whole, noting placement, the skeletal structure, so looking at eyes, center eyelid in comparison to the corners of your mouth, and that is midline. So also having a look at your jaw, looking for anything abnormal there. I'm not noting any wasting on either side. Okay, so facial symmetry does appear to be intact. I'm not noting any drooping. Can I just have you smile for me? Very good. You can go ahead and relax. So just checking your muscle tone there. If I can have you squint your eyes for me. Very good. Okay, so very strong on both sides there. All right. Okay. So I'm going to go ahead and perform some palpations with my hands. So what that means is I'm going to be feeling around with my fingers. And at this point, I'm just feeling for any differences on either side. So just relax for me. I do want you to let me know if you feel any pain or tenderness with any of this, though. So I'm just going to feel with my fingers. So just very small movements here, feeling around for any abnormality underneath the surface of the skin, looking for any signs of inflammation. Also just going to feel around the ears for any signs of abnormality there. Doing some flat palpation here underneath the jawline. So we're not noting any signs of inflammation along the lymphatic chain. going to gently feel underneath the eyes, feeling along the orbital socket. As well as along the brow bone. Okay, so far not feeling any abnormalities from one side to the other. Didn't feel any signs of edema, swelling, or inflammation. So I'm also just going to fill up into the hairline here. Not feeling anything here either. No signs of inflammation. I'm not feeling any lumps or bumps. I'm just going to use the back of my hands to feel for any temperature abnormalities. So just gauging the overall temperature and state of your skin. Noting any warmer areas. So far pretty consistent. Okay. Alright, so what I'm going to do is I'm going to test for any signs of inflammation. So I'm going to use this tool to very gently press down into the skin just like this. Now it shouldn't cause you any pain. All this is doing is allowing me to test for any signs of fluid buildup underneath the surface of the skin. So potential fluid buildup could be the cause of your loss of sensation. Essentially what that would mean is that there's a buildup of salt water underneath your skin that's causing you to feel like you're not able to sense things normally, and that's not necessarily a neurological response, that's more so just a blockage. So that's why I just want to roll it out first. So I'm just going to go around with this tool and very gently pressing, just seeing if I get any abnormal responses here. So far everything looks okay. Just poking into the buccal fat, looking for any signs of abnormality there. So far that looks okay. And I don't see any signs of inflammation along the chin. Neck as well up here is okay. And just using the other side of my tool once again to test for skin integrity and response. Alright, so I should say we can go ahead and begin with our sensory exam. So what I want to do first is I'm going to use my hands. I want you to tell me if the tactile sensation feels differently from one side to the other. So if I touch you here, does that feel the same on both sides? No. No, it doesn't. Okay. And does this side feel less? Yes. Okay. And here, does that feel the same? No. And here? No. And here? Okay. So all throughout it feels differently. Now, does it feel the same different? Do you feel it even less up here than you do here, or is it about the same? About the same. About the same, okay. All right. And if we go vertically, so here, that feels differently as well. In here.
Yes.
Okay, interesting. Right. Along the hairline, does this feel different as well?
Yes.
All right. I think I want to start with something simple. So just have a simple cotton wisp here, and one side feels a lot like a Q-tip. The other side is fairly sharp. Now, I'm going to start with just the soft side, and for this portion of the exam, I'd just like you to tell me when you feel it, okay? So you don't have to tell me what you feel, just tell me when. So for example, if I touch you here, you can either say you feel it or just respond yes or just nod your head, okay? Keep your eyes closed for me.
Soft.
Good.
Soft. 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 I can't feel it.
Okay.
I can't feel it. I can't feel it.
Okay, so you're not feeling anything here.
I can't feel it.
All right, so you would say that this here feels different than this here.
Yes.
Okay, so I'm going to move on to sharp sensation. Now, can you feel that this is sharp?
Yes.
Okay, so again, I just want you to indicate when you feel it, okay?
Okay. I can feel it. I can feel it. I can feel it. I can feel it. I can't do it. I can't feel it.
Okay. So can you feel anything here, or can you just, it doesn't feel sharp to you?
I can't feel it.
Okay. Can't feel anything. So there does appear to be quite a bit of loss here on the left side of the face. Can you feel it down here? No. Okay. So now I'm going to alternate between sharp and dull, or sharp and soft. So for example, if you feel this, this is soft or dull, and this is sharp. Okay?
Okay. Soft.
Very good.
Sharp. Sharp. Soft.
Very good.
Soft.
Okay. definitely some peripheral loss on that left side. So let's test. I'm gonna do a bit of a variation here. So I have 2 test tubes and I'm gonna test for spatial awareness. So if I touch you with 1 here, you should feel 1 touching your face versus if I touch you with 2. Can you feel that there's 2?
Yes.
Okay. So I just want you to indicate whether you feel 1 or you feel 2. Okay?
Okay. 1, 2, 2, 2, 1, 2, 1, 1, 2, 1, 2, 1,
Okay.
2, 1, 1, 1, 2, 1.
Okay. Here.
1
And did you feel the 1 on the left or on the right?
on the right,
Okay. And here.
on the right.
Okay. All right. Let's go ahead and try some vibratory sensation. Okay, so to give you an example, you feel vibration here?
Yes.
Okay. So just say yes when you feel it, okay?
Okay. Yes. 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 Yes.
Okay. So now I want you to tell me when the vibration stops. So you should feel vibration here. Tell me when it stops.
Stop.
Good.
Stop.
Very good. Okay, last one.
Stop.
Perfect. Okay, so you did well with the vibration sense. So I'm going to test for cold response now. I'm going to use the same tool this time. I'm just not going to have it vibrate. So it is very cold. Can you feel that this is cold?
Yes.
Okay. So I want you to just indicate to me when you feel cold, okay?
Okay. Cold. 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 Warm. Cold. 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 Cold.
Very good. Okay. So now I want you to try to differentiate cold versus warm. I'm going to switch tools because this one's a little bit colder now. Can you feel that this is cold?
Yes.
And do my hands feel warm?
Yes.
Okay. So just tell me whether you feel cold or warm.
Cold. Warm.
Nothing there.
Warm.
Okay.
Cold. Warm. Cold. And cold. Cold. Nothing.
Okay.
Warm.
Okay. So I'm going to test bilateral response. So I have two identical sponges here and they have two different textures. I'm going to start with the very soft, just regular spongy side, and I'm going to test them at the same exact time. So you're going to feel me touch you, ideally, on both sides of your face. I want you to tell me if it feels the same or if it feels different, okay?
Okay. Different.
Okay. Okay. And all along your face. Feels different?
Yes.
Okay. I'm going to use the other side. Same or different?
Different.
Okay. Same or different?
Different.
Same or different?
Different.
Okay. And does it feel different in that one side feels less than the other, or you can only feel this side?
I can only feel this side.
Okay. All right. So this time I have sponges that are more abrasive and more obvious in texture. So I am going to call this side 1 and this side 2. Now I want you to tell me which side you feel more, 1 or 2.
2. 2. 2. 2. 2.
There's quite a bit of loss on that left side. I'm going to take my stethoscope and have a listen and see if I can hear anything audibly that sounds different to me on either side. So just a second. Okay. Now this is going to be very cold. Just bear with me. I just want you to breathe normally as I have a listen. Okay. So I am hearing some differences in your circulation from one side versus the other. Your left side seems a little bit diminished. I'm not hearing quite as much perfusion, specifically in the temporal region. It does get a little bit better towards the bottom half of the face, but still not equally bilateral there. So that is a bit concerning, and obviously you are having quite a bit of loss at this point. I wouldn't even say it's mild. This is more of a moderate to severe lack of sensation. Now, I didn't feel any particular swelling or edema in your face, and given that you haven't had any injuries to your head or neck, I'm not certain that this isn't something more severely neurological that could be going on. So my next bet is to have you get an MRI. Now, what that's going to consist of is us putting you in a machine, circular. You go in and it kind of takes pictures of your brain and gives us a better idea of what could be causing the blockage, because it does seem that there is a dysfunction in your cranial nerve. Okay? If you're available today, I can take you over to get your MRI done. If not, we can schedule that for sometime next week. Do you have some time today? It takes about an hour and a half.
Yes.
Okay, perfect. So we will go ahead and get that done for you. Let me just call the tech and see if they have an opening in the exam room, and I will get you in as soon as possible so that we can see what's going on, because I am concerned that there might be some inflammation happening internally there, okay?
Yes.
Okay, all right, Fernanda. Well, give me just a few minutes and I will get that set up for you. I will come back and I'll take you over to the room when they're ready, okay?
Okay.
Okay, thank you.